MedInsight.
Hello everyone. Welcome to our YouTube channel MedInsight. Today, our presentation is on diagnosing a fever in under 5 minutes using medical tests. Fever, a common symptom, can indicate various underlying conditions. In this concise video, we will guide you through a step-by-step approach to quickly diagnose a fever with medical tests, so stay tuned to learn the essential techniques that healthcare professionals use to diagnose fevers accurately and promptly. I will take this further. Step 1. Patient Assessment. Begin by assessing the patient's medical history and symptoms. Record vital signs, including temperature, heart rate, and respiratory rate. Observe for any additional symptoms that may aid in the diagnosis. We carefully record vital signs, including temperature, heart rate, and respiratory rate. These measurements provide critical baseline information for diagnosis. Remember, patient assessment is the crucial first step in diagnosing a fever quickly and effectively. Join us as we delve into the subsequent steps to discover more about this essential process. Welcome back, viewers. In our journey to diagnose a fever quickly using medical tests, we have arrived at step 2, thermometer. To assess a patient's body temperature accurately, we employ a digital thermometer. This handy device provides precise measurements crucial for an accurate diagnosis. To begin, place the thermometer under the tongue, in the armpit, or in the rectum. These locations ensure reliable readings. Remember, it's important to follow proper technique and adhere to the manufacturer's instructions for optimal results. By utilizing this straightforward yet essential step, healthcare professionals can gather vital information to assess the patient's condition swiftly and effectively. With the temperature measurement in hand, we move closer to unveiling the cause of the fever, enabling us to take prompt action. Stay tuned as we continue our journey, exploring additional crucial steps to diagnose a fever within minutes using medical tests. Remember, accuracy and adherence to proper technique are key in this process. Join us next time as we delve deeper into the world of fever diagnosis. Now let's move on to step 3, temperature reading. Once the temperature measurement is complete, it's important to record the reading accurately. Remember, a normal body temperature typically falls between 36.5 degrees Celsius and 37.5 degrees Celsius, 97.7 degrees Fahrenheit to 99.5 degrees Fahrenheit. If the body temperature exceeds 38 degrees Celsius, 100.4 degrees Fahrenheit, it is considered a fever. This information plays a crucial role in the diagnosis process, helping us identify potential underlying conditions. So, let's ensure we take precise temperature measurements and record them diligently. Ready to continue our journey towards diagnosing fevers? Let's proceed to the next step. Ladies and gentlemen, let's proceed to the next steps in our fever diagnosis journey. Step 4 brings us to additional investigations when the cause of the fever is not immediately evident. In such cases, further tests become necessary. Blood tests are highly valuable as they can help identify potential infections or underlying conditions. Some common blood tests include the complete blood count, CBC, which gives us a comprehensive overview, the C-reactive protein, CRP, test, which detects inflammation, and blood cultures that help identify any infectious organisms. Now, let's move on to step 5, urine analysis. This test provides valuable information about urinary tract infections or kidney-related issues. To conduct the analysis, we collect a clean catch urine sample for testing. By examining the urine, we can detect the presence of bacteria, white blood cells, or other abnormalities. Moving on to Step 6, Imaging Tests. In certain cases, we may need to perform imaging tests to identify the source of the fever. X-rays, CT scans, or ultrasounds are utilized to visualize organs and detect any abnormalities or infections. Lastly, Step 7, Additional Specialized Tests. Depending on the patient's symptoms and suspected diagnosis, we may require additional specialized tests. Examples of these tests include throat swabs for strep throat, viral antigen tests, or serology tests for specific infections. In conclusion, diagnosing a fever quickly is crucial for timely treatment and management. By following these steps and utilizing appropriate medical tests, healthcare professionals can reach an accurate diagnosis in under 5 minutes. Always remember to consider the patient's overall clinical presentation and consult with a medical specialist if necessary. Thank you for attending this presentation on diagnosing a fever using medical tests. We hope you found this information valuable and informative. If you have any further questions, please feel free to ask.